Hi, I'm Christine Upchurch. If you joined me the other evening talking about how to clear out some of the collective grief, I have a footnote to that. I wanted to tell you about something that happened to me that night that kind of underscored something. And I also want to talk a little bit about how that may relate to the hate crimes in Charlottesville and Barcelona and terrorism. Anyway, the other night, hi there, Kevin. Hi, Istabel. Hey, Roll's there too. Um, the other night, something happened to me after I'd gone live talking about collective grief and how we need to sort of honor the pain that we feel. And if you missed it, you can go back and check that out. But I did want to mention to you about something that happened because it actually underscored something for me about the grief. That night, as the wisdom of the universe showed me, maybe the wisdom of the universe is more like twisted humor of the universe. But that night, I had to get up in the middle of the night to deal with something relating to my cat. I won't go into any of the gory details associated with it, but suffice it to say, I was cleaning her up in the middle of the night, and something unexpected happened. She is a really sweet cat, but all of a sudden, she turned around and she clawed me, and it was a deep, deep nick. So, to my surprise, I started bleeding. And it was not just like profuse bleeding. It was kind of like a spewing out of blood over and over again. And I had never experienced that before. And I'll talk a little bit about what that was. I didn't realize at the time. And eventually I got the bleeding to stop. But it put me in this really vulnerable place because it just sort of underscored how fragile life is. And, I was fine. And I called the insurance hotline, and they told me to go into the hospital, just get things checked out, and I did. So anyway, when I was at the hospital, the doctor explained to me that there are different layers of cuts. I mean, you can get the cuts to the capillaries, the little tiny veins, and they're more surface. Then there are the veins, and the veins basically are bringing the blood back up towards the heart, and if you have cuts into the veins, it can be very serious. But when you hit an artery, which is what my cat scratch did, it can spew out, and it can actually be very dangerous because you can bleed out quickly. So there I am in the hospital, and I'm perfectly fine. However, I'm a little stressed out about the whole situation. So, the doctor got me the prescription for antibiotics, just in case. And so there I am lying in this hospital bed, waiting for the nurse to come back in. And as I'm lying there, thinking about the wonderful care I've gotten there, fabulous doctor, fabulous staff, I'm waiting for the nurse, and I'm lying there alone, and I'm realizing I'm alone in the ER right now. And I felt very vulnerable, a few moments before, an hour before. And then I realized that this emergency room was the exact same ER that my father was brought to several years ago. And he was brought by ambulance by himself, and he died there. And all of a sudden, it's funny, 6 years after the fact, I'm experiencing a deeper grief, about not having been there for my father, for the fact that he died by himself, right? And yes, there were caring staff dealing with him. However, it was kind of like I was grieving another layer of my grief associated with my father's passing. And it kind of surprised me. And I came to this realization that allowing ourselves to feel the grief, it's very connected to our vulnerability. We have to kind of feel vulnerable in order to experience that grief. And so there I was, having felt vulnerable because my blood had been spewing out, and it was a scary experience, just briefly, but it was scary nonetheless. It allowed me to feel that other experience of another layer of grief associated with my father. And so it kind of helped me to realize that vulnerability and grief are very connected. And I know that Brene Brown, who's a fabulous researcher, really wonderful writer and teacher, her research has indicated that vulnerability is a very essential part of connecting with others. but I think it's also an important part of connecting with ourselves. So I think that what's going on right now in the world, there's such extremes that it's making us feel more vulnerable. And I kind of liken it to, I don't know, the different layers of cuts to the fabric of our civilization. For instance, the capillary level of cut would be like, oh, the hate rhetoric on Facebook, or the road rage that we experience, when driving on the freeway. The deeper vein level of cut to our civilization relates to things like murder between two people who had some sort of disagreement, robbery, those things that are important and awful crimes, but they're more kind of one-on-one kind of thing. And then I think that the artery level of cut in our civilization are things like the hate crimes, the white supremacy, the terrorism against strangers. So it kind of helps me to realize that, number one, we need to sort of look at what's going on in our world and decide what level of cut we've got. And if it is to the artery level, we had better put pressure on it. We better prevent the bleeding out of our civilization and our hopes for a peaceful, loving world. And then secondly, I think that we also need to make sure that we allow ourselves the experience, the vulnerability of feeling our sadness. And then, of course, do what we're inspired to do in order to kind of put the pressure on and prevent the bleeding out, whether it be finding peace within your heart, whether it is coming together with other members of your community, maybe reaching out to people who are different than you in some way, or making phone calls to politicians, whatever it is, showing up in a protest. But I think it's important for us to just go ahead and look at the trauma for what it is and take action about it, and also to allow ourselves to feel the feelings. Okay, this is Christine Upchurch signing out. Thanks for joining me, guys.